Joining me now is Dr. Alistair Martin, an emergency physician at Massachusetts General Hospital. He's also the founder of Vote ER, a program that helps patients register to vote. Dr. Martin, great to have you with us. Thank you so much for joining us. Can you explain to us a little bit about how your program is working?
Well, thank you so much, Eamon, for having me. Look, the bottom line is this. COVID-19 has made voting a public health issue in the 2020 election. And all around this country, healthcare providers see the impact of what is, quite frankly, dysfunctional healthcare system, quite frankly, a dysfunctional public health response to what is the worst pandemic we've ever seen or have seen in over a century. And so if we are going to have a better healthcare system, more fair, more just healthcare system, if we're going to have a public health system that can anticipate and be on top of these sorts of calamities, we need to vote. It is the most important and powerful change agent that we have, as the late John Lewis said. And so our organization, Vote ER, helps our patients, our colleagues, and our friends and family get registered to vote. And physicians and healthcare providers are helping to do that all across the country.
It is quite impressive to think about the intersection that happens where you're doing this registration. Why the ER, though? Why is it important that people who come in there for care also register to vote? Because one of the interesting facts, I think, is if you kind of superimpose the maps of the demographics between those who are not registered in this country and the demographics of the groups who need to use places like emergency rooms to get primary care, there certainly is an overlap, would you say?
That's exactly right. And look, Eamon, the facts are this. Millions and millions of people come into ERs every single day, and they don't have an emergency other than the emergency of not having a primary care doctor or the emergency of not having health insurance or being underinsured. And so when you look at the numbers or the folks who are demographically represented in, the marginalized by our healthcare system, it's the same exact folks that are not registered to vote. And so the question is, can we create a system that makes it optional if folks want to get registered while they're waiting in their primary care doctor's office or the ER, they're there with no emergency, or in community health centers?
Tell us a little bit about the starting of this program. What motivated you to start the program? And do you have any plans to roll this out across the country at other hospitals? Where does that stand as of this morning?
Yeah, it's a great question, Eamon. So, my background is that I worked in policy prior to going to emergency medicine training and learned the importance of electoral participation and the power of the vote. As I mentioned, the late John Lewis said, the vote is the most powerful change agent that we have in a democratic society. And so we see on a nightly basis as healthcare providers, as physicians, as nurses, as social workers, the brokenness of our healthcare system. We see the faces of failed healthcare policy, and they're not smiling. And so if we are going to help create a better healthcare system, more fair healthcare system, more just healthcare system, we've got to help our patients register to vote. And at this moment, we're in over 100 hospitals, which is just absolutely inspiring. And over 15,000 healthcare providers have these, or will soon have these, which are QR codes that patients can use to register themselves to vote while they wait in waiting rooms.
Thank you for checking out our YouTube channel. Why don't you subscribe? It's really easy. Just click on that button down there. And for more news from MSNBC, click on any of these videos here for the latest interviews and highlights. You can get more videos from MSNBC with our newsletters. Head over to msnbc.com/newsletters to sign up.